Hello, this is Gemma from Asthma Australia, Senior Asthma Educator, here doing the next live video for our organisation and for all of you around Australia. We're looking today at understanding asthma symptoms, understanding triggers and viral triggers in this time with COVID, essentially. So when we're looking at viral triggers in asthma, so let's go to a normal year. Let's go for a non-COVID year. We all, health professionals know, and a lot of people with asthma know, that when they get a cold, or when they get a virus, or when they get flu, they're going to have a flare-up of their asthma symptoms. And that is going to be worse if we're not taking our preventive medications. So what's happening is, if we go back to the last session that I did, and actually just before I go on, we're having some issues with the closed captioning. So if we do have, after the video, the team is going to try and add the closed captioning in. I wasn't able to select it on my Facebook feed here today. So I do apologise in advance if there's anyone out there with auditory or hearing difficulties. We will try and get that closed captioning working, unless a comment appears saying that it is actually working for me miraculously without me doing anything, which would be lovely. So going back to why we're using preventers, the inside of the airways and virus triggers. So remember the inside of that airway, if we remember the discussion I had last time, in an asthma airway it's red, it's irritated, it's very sensitive, there's lots of redness and irritation, a bit of mucus happening in there, an angry place. When we come up against a virus or a cold or a chest infection that might be bacterial needing antibiotics, or a flu, that redness and irritation and sensitivity is going to happen on top of the redness and irritation that's already there in the asthma airway. So that's why we get a flare-up of symptoms with viruses when we have asthma, because we're adding sensitivity and irritation on sensitivity and irritation that's already there. So that's why it's so important to take the preventer medication. Now, if you remember back to the other broadcast that I did, we discussed about preventers. We discussed that the preventers are in two categories. There's the inhaled corticosteroid preventers just by themselves. There's the inhaled corticosteroid preventers plus a long-acting reliever. So they're the combination. And it's the inhaled corticosteroid in both of these medications that is treating the underlying cause of asthma. It's treating the sensitivity, the irritation, the sensitivity, the mucus production, all of that swelling inside the airway. It's treating all of that. And remember how we said that it takes time for those to work. So they're not going to work in a couple of minutes or a couple of hours, a couple of days. They're actually going to take a significant time period. So we're looking at least 2, 4, 6, 8, 12 weeks, depending on the person, depending on how bad the severity of symptoms inside those asthma airways are. So if we're taking our preventer and we're reducing that sensitivity on the inside of the airway, when we come up against a virus, which will probably, I'll say probably, not always, but probably, and for those that know they always get an asthma flare-up with a virus, it will be less flare-up than if you hadn't been on the preventer in the first place. So it's really important to take those preventers in order to protect us against the viral triggers out there in the community. Now with COVID, as a lot of the doctors have been saying on our Facebook feed, as we've been putting out on the social medias and the asthma educators on the phone, is look, we don't have a great deal of information with regards to asthma and COVID, and the information that's coming out is there's not a great volume of it to be able to make informed decisions on that. So if you are aware that you have viral triggers are things that flare up your asthma, then we can say it's a possibility then that yes, a COVID viral infection would set off your asthma symptoms as well. But we can only deal with possibilities and maybes because we're not really too sure. And all of the doctors have said that, and the specialists have said that we're just looking at what's happening around the world, but we also have to look at what's happening in Australia, because remember, every environment is different, and how each environment's asthma communities are different. How asthma communities in Queensland versus New South Wales versus Tasmania are different. The suburbs within Queensland are different based on the environmental conditions. So it's really difficult to have a one statement fits all in this particular time, because we are all learning with regards to what's happening with asthma and COVID at this particular moment in time. So what we've been putting out there on our socials, the asthma educators have been saying on the phone, the doctors have been saying in their live videos, is we want to try and reduce the viral load that people have at the moment. Now, everyone's social distancing at the moment. We can all see that there's a flattening of the curve, which is amazing that everybody's taken all of this on board, and we're in such a better position than so many of all those other countries around the world. And you'd all agree with me, and all the asthmatics I'm sure agree with me, this is really good news for us, and it's good news for everybody. If we're going to flatten that curve, and like Queensland and WA, I think, don't quote me, but I think had no extra cases overnight. So that is absolutely fantastic. But there's still other viruses around, and we actually have seen a bit of a flattening of a curve already for flu, because people are social distancing. So what we're doing for COVID is actually really good for all the other viruses, because we don't have that contact. But it's still important to try and decrease the viral load as much as we possibly can. So if anyone is sick, any family, if you know there's someone who's going to be coming over to your house to drop off groceries or something like that is sick, they drop them off, they walk away, you wait a little bit, then you bring your groceries in, wash your hands, all that kind of jazz. Or to be honest with you, actually, could I have someone else drop them off because you're sick? Even if it is with a cold, and it's just a tinsy sniffle, just because we just want to be just very, very, very careful that we don't get sick with something else. Because if we get a cold or we get flu, and then we were unlucky to get COVID on top of that, and say maybe we weren't taking our preventers particularly well, oh dear, we might find that we have a big flare-up of our asthma symptoms, and that then might lend us into hospital for a treatment of that. Doesn't necessarily mean that the COVID infection is going to be any worse. It might be, it might not, but our asthma symptoms might be. So I know that there's been a lot of pictorials on the internet from WHO and from other countries as well. Our government's put out the one from the WHO, and I'm just going to bring it up now on my computer so I'm talking to it, if that's okay, just so that I'm not getting it wrong. And my wonderful helper Lauren is in Asthma Australia, is going to put it up in the feed as well. So there's the three different categories there: the COVID-19 symptoms, the cold symptoms, and the flu symptoms. Now I know a lot of you would have already seen this already, but if you haven't, then pop to our website or pop to the Australian government websites and just type in COVID-19 identifying the symptoms. So that was COVID-19 identifying the symptoms, and that will help you find that particular pictorial. So it goes in to say there that, the different common things between COVID, colds and flus. Now, with asthma, of course, there's not an asthma line there, but we know with asthma that we get a cough, a dry cough, sometimes a wheezy cough. And sometimes that happens when we're out and about, and then people are like, are you sick? Oh, I don't want to be near you right now. And that's really stressful for us all. When we're out and about, I was in a chemist the other day and I was trying to suppress my asthma cough. And I've seen on some of our socials that people have said that as well, that they're like, oh, when I'm out and about, I don't, I've got this little buffy cough that I want to do, but I want to keep it in because I don't want people to think that I'm sick with COVID. Now, with asthma symptoms, so let's go over the asthma symptoms. We've got cough, potentially. Not everyone, but most of us do actually have cough, particularly when the temperature changes, and obviously if anything's irritating our airway. We get chest tightness, maybe, and that's, remember, there's the muscles squeezing tight. Yeah, so that's why we're getting chest tightness. We may have wheeze. So I'm forcing a wheeze there. Don't worry, I don't have asthma at the moment, but I'm forcing a wheeze just for a bit of sound. Not everybody has wheeze. There's a lot of people that don't get wheeze as some of their symptoms. Sometimes it's predominantly cough, but some people get wheeze. And then, of course, we get shortness of breath. Now, look, if I look at the COVID symptoms, cough, common, shortness of breath, sometimes, and nothing else there with regards to wheeze or chest tightness. So if we're looking at asthma symptoms and is it COVID, one of the main things that doctors are looking for is fever. Asthma doesn't have a fever unless you're unwell. So unless you've got I see someone talking about temperature changes are the worst. Yes, Lynn, temperature changes are the worst, but I'm not talking about environmental temperature changes, and maybe you're not either. But when I talk about fever, so we're looking at a fever of 38.5 and above. So we're talking about significant fever here. Asthma doesn't normally have a fever. So if you've got fever with your asthma symptoms, then you need to contact your doctor, because that's not normal. If you have a cough, no shortness of breath, and it's your usual asthma cough, so it's in a time that you would normally have an asthma cough, the temperature's changed, you've breathed in something that's been irritating, you've walked past a plant that's got a pollen, someone sprayed something near you and you started to cough, then if that's what normally happens to you when you are exposed to those triggers and you have a buffy cough, then that's more likely to be your asthma. So then taking your reliever medication and seeing if that cough goes away. If I've got cough and I've got shortness of breath. All right, so we've got two of the symptoms now of COVID. I've got no fever. Have I been in contact with anyone with COVID? Have I been in contact with anyone that's sick? Am I a healthcare professional? Am I a teacher and I'm working with kids? Do I think that I've had contact? Ring the doctor and just ask. Take your asthma medication though. Follow your written asthma action plan, because if those symptoms go away, if the shortness of breath goes away and the cough has gone away, then more likely, so not positive, but more likely it will be asthma and not COVID. So remember, there's an infection process going on here. There's an infective thing. So they're looking for that fever. Now, if you're out and about and you've got that buffy cough and you're really feeling very stressed about that, if you want to ask your doctor for a letter that says I have asthma, hello, I have asthma, then fine, do that. That makes you feel better. Go for it. Say, oh no, it's my usual asthma cough. Now look, I know there's a lot of people that don't like to say they have asthma. They actually feel a bit embarrassed about the fact that they appear sick, that it's a weakness, and that's not everybody. That's some people feel like that. They don't want to let on that they've got asthma. And that's okay. If you don't want to let on that you've got asthma, that's okay. You don't have to do that. If you want to let on that you've got asthma, great, because that might just help a little bit of community understanding. And, just that, let's just be kind to people, We need to show kindness at the moment. It's really important. So do have a talk to your doctor about your feelings about that, as to whether you'd like to have a little letter in your pocket in case anybody was, really losing it with you. If you're going into the chemist and you're sick and they're saying, oh, you're sick, here, I've got asthma, this is my usual cough, I normally have cough, and I've walked into some air conditioning and that's caused me to cough. But be mindful that if you're getting those kind of symptoms, why are we getting those kind of symptoms? Because if we go back to the previous session that I did, and we were talking about triggers, and if we're experiencing triggers and we're experiencing asthma symptoms, then maybe we haven't actually got good asthma control. If we haven't got good asthma control, then we need to be talking to our doctors, because maybe our medications aren't quite right. So if we've got asthma symptoms on more than 2 days in 1 week, if we are using our reliever puffers more than 2 days in 1 week, if we've got any nighttime symptoms, if we have symptoms on activities of daily living, things that we would normally do. I have symptoms when I'm showering, I have symptoms when I'm hanging out the washing, I have symptoms when I am walking down the street with my allowed activity, and I don't normally have symptoms walking down the street with my allowed activity. And these things are happening throughout the week, then that's a sign I need to go see my doctor. And I need to have my action plan looked at, I need to have my medications looked at. Am I on a preventer? Am I not on a preventer? Is it enough preventer? Have those discussions with the doctor. We don't necessarily have to go see the doctor now. A lot of doctor clinics are doing telehealth only. So I know my GP is doing telehealth only. There's actually no option to go into the clinic unless they say so. Organise a telehealth appointment, and that can be done by video or by phone. They're bulk billed at the moment with the GPs. And if they need to update your written asthma action plan, one of the educators was mentioning that her client was scanning it into her email. She sent it to the doctors, and then they talked about it during the consult, and then he changed it and he sent it back. Now, if you don't want to upload your personal health information via email, which I get, and there's privacy issues there, that's fine. Discuss it over the phone with your doctor where you're at on that particular plan. Hopefully they should actually have a copy of it scanned into your records anyway, and get them to post it to you, so that things aren't being emailed between the doctor's surgery and yourself if you're worried. I'm just going to do a couple of questions here while I've got them in front of me. Steve, I was very concerned about this report in The Guardian. Foresters are still burning off with high energy fires despite the COVID epidemic. Can Asthma Victoria raise this with the government? Yeah, we're still doing a lot of advocacy around the bushfires, and obviously back burning and word is gone. Reduction fires, thank you, sorry. And actually close to my house, the Defence Force is doing a hazard reduction burn at the last couple of days. So I've got my house closed up because it really irritates me, and it irritates my allergic rhinitis, which then sets off my asthma. And so yes, we are still looking at the advocacy around the hazard reduction burns. There's a lot in Tasmania as well happening at the moment with hazard reduction burns. Just having a quick look at some of the other questions. Sharon tends to wheeze at night. If that's every night, Sharon, or even just a couple of nights a week, then make an appointment with your doctor would be the recommendation. Mona. Sorry, I might go to the very top of the questions and go down. Heather can't tolerate preventers. Oh, that's a pity. Have you seen a respiratory specialist, Heather? And have you just seen your GP, or are you seeing a respiratory specialist? It would be good to see a respiratory specialist. Mona, I always feel shaky and worse when I get my preventer might be wrong one. If you're on a combination preventer, Mona, with the long-acting medication that's in there, that can make you a bit shaky, especially if it's on a higher dose. So maybe just double check that with your doctor. Just make an asthma review appointment, telehealth. Tell them that you're feeling shaky when you take when you're taking your preventer. Because if it is one of those combination ones with a long-acting medication in it, then it can do. It can make you shaky, and it might be that you just need to drop dose. But that's something that you have to discuss with doctor. That's not going off what I've said today. That's you might need to drop dose. You don't do that by yourself. You need to go and discuss it with doctor first. Lindsay's listening from New Zealand. Hi Lindsay, how are you doing? And Kate Green has said that that's right about WA in the numbers. No extra numbers of COVID overnights. That's fantastic. Irene is saying, I feel the same with higher doses during a flare-up. I'm assuming that's with regards to Mona's comment about feeling shaky. Once again, that could be the long-acting medication that's in it. Have a chat to your doctor. I'm just reading David's at the moment. Oh, okay. Been in quarantine for quite many days. Occasional productive cough. Oh, I've done it again where I've switched the screen around. Oh, there we are. I'm back again. I've learnt from last time. Productive cough is not normally part of asthma, so there's obviously something infective going on there. Jenny's listening to from New Zealand as well. I think I'm back down to... Oh, Kylie. My 5-year-old is asthmatic and has a history of asthma, pneumonitis, pneumonia, RSV, right? Okay, lots of etc. So just got diagnosed with chronic lung disease, but the last 2 months her asthma has flared up. Yeah, I'm sorry, I'm just pressing to see more. And she's had the flu injection, which made her cough. She's coughing at the moment. She snores and sometimes has night coughing. Make an appointment with the GP, Kylie. So the issues there are the... when did she start the 25 micrograms of a preventer? So going back to the beginning of my discussion, preventer takes time to kick in. So if it's only just been started, it can take up to 12 weeks to show full improvement. So you're improving up to that point. So some people find up to 2 weeks, 4 weeks, 6 weeks, 8 weeks, up to 12. So maybe make an appointment with the doctor if she's been on it for about a month. Then definitely make a follow-up appointment with the doctor and talk about ongoing asthma symptoms. If she snores, wonder whether she needs an ENT referral, potentially. Have a discussion with the doctor about that. Has she got large adenoids? The other issue there is hay fever, potentially. So if there's any hay fever, that can make asthma worse and bring on more asthma symptoms because it's all attached. So the nose is irritated, it's red, it's sensitive, just like the airways and the chest get. And if we don't treat the allergic rhinitis or the hay fever, then it can set off asthma symptoms. So the fact that she's snoring could be from hay fever, it could be from large adenoids, could be a blocked nose, and that's why she's snoring. So there's lots of things it could be. So it's a really good idea to have a discussion with the doctor and try to nut out what it could actually be and try and solve that. Lindsay, can you find out what triggers your asthma? My daughter is 15 and has an asthma cough most days. Lindsay, it's kind of trial and error. So on our website, which has been down all morning, I've got to say, so it's not being very helpful with our asthma, with our website being down. But when it is up and running, there's a whole page on triggers, and it really is a matter of watching and seeing what she reacts to. So if you notice that you smack a pillow, for instance, like a cushion, and it's a bit dusty, and then that sets her off, then dust. If you notice that there's something that pollen's outside her room, or she walks past something and that sets her off, well, it could be pollen, or it could be that particular tree, or things like that. If there's a change of temperature in the air, so the coughing happens early in the morning or late in the evening when there's a temperature change, then that could be a trigger. So have a look at when our website's up and running, have a look on the website at all the different types of triggers, and do a little bit of a symptom diary. So writing down what is setting her off and what you've done about that, and has it solved the issue. So, flicked pillow, caused cough, gave blue reliever, puffer, or whatever reliever she's on, and that solved her cough. And just keep a little running list of that, because then those things can be added into a written asthma action plan. But yeah, she's coughing most days. She needs to see the doctor. Mona. Oh, thanks, Mona. Symbicort 2 twice daily. Symbicort Rapihaler, the red one with the grey lid. And are you on the 206 of that? Because there's so many different doses. If you are on the 206 and you're taking 2 in the morning, 2 at night, that's the top dose of that particular medication. So maybe it is a little bit of the long-acting medication that is causing that shaky feeling, and having a discussion about dropping down to the next one down. However, you need to make sure the asthma is under control. So we really shouldn't be stepping anything down if you've got poor asthma control. So if your asthma has been controlled for the last, say, 2 months, 2 to 3, 3 is gold standard, but 2 to 3 months, then you could talk with your doctor about stepping down to the next rung under that, which is the 103, and see whether or not that helps. So it's the 6 and the 3 number. That's the long-acting medication. So if you're taking 206, the inhaled corticosteroid is the 200, so you're actually getting 400 in 2 doses, and the 6 is then up to 12 in those 2 doses. So it might just be a bit too much for you. But if your asthma isn't well controlled, then it's a good idea to have a discussion with doctor, because maybe Symbicort isn't right for you. It's a discussion you have to have with doctor. Hi, Michelle from Perth. How you doing? Lynn, lots of hay fever and weeping from your eyes, like sort of, like they just decide to tear up. It's really important to treat hay fever and your weeping. National Asthma Council's just put out a new treatment plan for how hay fever is treated for asthmatics. Normally, first-line treatment for an adult is an inhaled nasal corticosteroid, which you can get from your chemist, but it's always a good idea to discuss it with your doctor first in case something else is going on, rather than just treating something and you're not really too sure. But yeah, so nasal sprays up the nose morning and night, depending on the particular nasal spray. Some are daily doses. It's really important to treat the nose and the chest. How long do the lungs need to regain previous lung capacity after an exacerbation 2 weeks later, and my peak flows still show reduced capacity? It can take time. It really depends on what the severity of the so you've used the word exacerbation. Not everybody knows what that means. That's flare-up or asthma attack. So flaring up of your symptoms. So exacerbation is the medical term. It really depends on the severity of that flare-up or exacerbation as to how long it's going to take to get back to your baseline. Michelle Coles, my aunt in the UK has a vaccine for pneumonia. Is there a vaccine here in Australia? Yes, there is, on the national vaccine program. Over 65s and over 50, I believe, for the Aboriginal and Torres Strait Islander communities. My computer's just gone to sleep. Maybe Lauren could find that for me and pop that into the feed with the link to the vaccine schedules. But yes, there is a pneumonia vax. If you're over 65 and not an Aboriginal or Torres Strait Islander, then give your doctor a call, because definitely getting Pneumovax is important. Only one is available on the free schedule though, not two, just one. Steve, sorry, about the industrial burns. Well, we've got the web address there that you've shared, so we can have a look at that, Stephen. Kylie, she's got grommets for her ears. Kylie, your daughter was snoring, is that right? If I go back, I think. Yeah, so if she's seen, yeah. So in order to get grommets, she would have seen an ENT specialist. So yeah, have a chat to the doctor just in case it is actually her adenoids. But you'd need to double check that with the doctor because there could be so many different factors going on there. Lynn, preventers are great. Yes. Say that many times. Tell everyone. Shout it from the rooftops. Kylie says when her daughter gets sick, she always ends up in hospital on oxygen. And her oxygen levels drop overnight. Yeah, really need to talk to the GP and potentially the ENT specialist about that. Because if it is her adenoids, which then are blocking her ability to breathe properly, which means like it's actually holding your nose all night, and then if her oxygen levels are dropping because of that, she might not going to be able to get the right levels of oxygen. And if she gets sick with a virus, she always ends up in hospital. Oxygen levels can drop with an asthma flare-up when it gets to that severe point that you're very tired. Kylie, can you use nasal sprays in kids? I always get told to use the saline spray. Yes, saline's good for getting out the irritants out of the nose. So say, they've smelt some, they've got dust, they've walked past something dusty or polleny or something like that, been out in the garden playing in the dirt. Saline's good for getting that irritant out, yeah? But it's not really doing anything for the redness and the irritation on the inside of the airway. So generally an antihistamine is first line and then the nasal sprays with the kids, and only some nasal sprays are okay for certain age groups. So it's a really good idea to have a talk to the doctor first and come up with a plan for treating the hay fever. But she sounds quite complicated because you've got the snoring and all of that kind of stuff in there as well. So you really need to chat to the doctor about that. Michelle saying that your dad should have the Pneumovax. I think that's what you were talking about. Yeah, probably a good idea. Lindsay, didn't realise there's vaccine for pneumonia. Yep, there is, but only if you're over 65 for non-Aboriginal and Torres Strait Islanders. Another one, preventers great. Keep going. Do humidifiers help with asthma at night? Oh, I've double tapped again. Sorry. Not normally. They are, if you're having asthma symptoms at night time, it's down to that sensitivity and irritation in the airway again and not having good asthma control, Lindsay. Michelle, about the Ventolin, yeah, because people were panicking, that's why. Lisa, I'm going into my 3rd week of recovering from an exacerbation of asthma due to infection. Is it normal for it to take this long? Sorry, 3rd week of recovery from exacerbation, yeah. Doctor checked my chest today. He said it was clear, but don't. Sorry, pressing things. It can take time to get over it. Oh, I'm doing it again. Jeez. You just get rid of me. No, stop it. It can take time to get over an asthma flare-up. It really can. So hang in there. If you've only just started preventer or something like that too. Lisa, remember at the beginning of the talk we were talking about it takes time for it to kick in. And if it's been all sensitive, even if you are on preventer and it's been really sensitive and irritated, it's going to take time for that preventer to sort of settle things down again. So so give it time. But if you are really concerned, then make another telehealth appointment and discuss it with the doctor. You know, do you need to go up on preventer for a little while just to try and get back that control that you're not got at the moment? Lindsay, daughter changed to Brio. Yep. I haven't started monitoring her heart rate and it seems high for a teenager at 95. So Flixitide is just that single inhaled corticosteroid. It doesn't have the long-acting medication in it. So they've ramped her up. From what I can read here, it would be because she hasn't got good asthma control. So they've ramped her up to the combination preventer, so it's the one with the long-acting medication in there as well. So that's the one that can cause a little bit of shakiness. It can increase your heart rate a little bit. It's just a daily dose. It's very good because it is just a daily dose, so it's easy to remember. Don't really worry about monitoring heart rates too much. Unless it's really a problem for her. You know, if she's feeling like she's got palpitations or she's got a racing heart or she feels really shaky, then go back to ring the doctor, make the telehealth appointment. I keep saying go back to the doctor because it just falls off my tongue. But make the telehealth appointment because it's good for them to know that. Things like that generally start to settle down. Oh, apparently I'm doing a good job. Thanks. Judy, you bought a nebulizer. Judy, do you just have asthma? Have you got something else going on other than just asthma? Nebulizers aren't really first-line therapy anymore in asthma treatment. So they're not the gold standard anymore. And particularly in the COVID situation at the moment, the National Asthma Council has put out information that we need to be very careful with nebulization. So even the hospitals are not using nebulizers. So if you have an asthma flare-up and you go to hospital and they don't put you on a neb, don't be surprised. They're actually trying to limit the droplets. So you know when you've got a neb, it mists everywhere and you've got these little droplets going everywhere. So if you did have a virus, and not even COVID, like if you've got colds or flus or something like that, or if you do have COVID and then you've got that misting going on, then that's going to transmit virus everywhere in the room and onto everyone else around you. So using a nebulizer, you've got to be really careful at home that if it's on your asthma action plan, your doctor has said you must do this. You know, they've indicated that that's part of your plan. It's not normal for the mild to moderates. Sometimes in severe asthma you see people going onto nebulizers, and definitely in other respiratory conditions, so COPD, emphysema, bronchiectasis, cystic fibrosis. You'll see antibiotics in those antibiotics nebulized, and Ventolin or Asmol or Atrovent nebulized for those conditions. But in asthma, the recommendation is a spacer and a puffer type medication is just as effective. Obviously, if you're not using a puffer and a spacer, you've got some other type of reliever, that's fine too. But a lot of people have the puffer and the spacer, and that's actually just as effective and quicker and cheaper and easier to maintain than a nebulizer. So maybe have a look at the National Asthma Council information on that, and it's on our website as well when it's working. So it's been down a little bit this morning, unfortunately. Thanks, Lindsay. Judy, you had a bad cough virus for a couple of weeks, lots of antibiotics and lots of mucus. Okay, Judy. Yeah, has your doctor mentioned anything other, and you use a puffer as well? Yeah. Has your doctor mentioned any other respiratory or lung conditions other than just asthma? With the lots of mucus. But that's okay. If doctors... Oh, thank you. At the doctors. they put me on the nebulizer. Yeah, nebulizers are used heavily, well, normally outside of COVID, in the doctor's surgery or in hospital, and that's kind of where they want to keep it. You know, keep hospitals, hospital, doctor surgery, community, something different. And that's usually because people are quite severe by the time they need a nebulizer, so they actually want to be monitoring you rather than you doing it at home. But if doctor says to do it and it's written on your asthma action plan, then, you know, that's fine. Katie, we are new to asthma. Is it bad to use the puffer once to twice every day? Which puffer, Katie? Blue one? Blue grey? Preventer? Depends what you're talking about. If you want a really awesome asthma session, Katie, on asthma management and all of your medications, then I'd really encourage you to ring in on our 1-800 line, which is 1-800-278-462. That's 1-800-278-462, because we can spend up to an hour on the phone with you, running through everything there is to know about asthma, and we can you know, send you some email information and write you a letter and all those kind of things. And we also have a thing called a coach program as well that can really help you over a 6-month period, or up to a 6-month period, and supports you in your asthma management. So if anybody's feeling a bit stressed at the moment with their asthma, they're feeling that they don't want to go to the hospital or the doctor, or and they want some help with managing over the next couple of months, then you can do a self-referral to the coach program, which is on our website when it's working. So the coach program is one of the educators works with you to help you manage your asthma, look at treatment gaps between what the guidelines say and what you're doing, and try to identify areas that we can improve your asthma control. So really good for newly diagnosed asthmatics, Katie. So with the blue, if you're taking that once or twice every day, then that indicates poorly controlled asthma. So if I go back to talking about asthma control again, so if we are taking blue reliever puffers on 2 days in 1 week, or sorry, more than 2 days in 1 week, if we've got asthma symptoms more than 2 days in 1 week, if we've got any nighttime symptoms at all, or symptoms on activity that we wouldn't normally have symptoms on. So I'm hanging out the washing, I've got symptoms. I'm having a shower, I've got symptoms. I'm doing stuff with the kids, I've got symptoms. I'm walking down the road, I'm walking up my driveway, I don't normally have symptoms, but I now do have symptoms. Then that's an indication of poor or partial control of asthma, and it's important to get an asthma review. So if you're using your reliever medication, the blue one, Katie, every day, then you need an asthma review with your doctor. But give us a call. I think I'm in there this afternoon, so you can talk to me, and we can have a chat about your asthma management. Judy, clots on the lungs after hysterectomy a few years ago. Would that have weakened their lungs? So like PE, you probably and you might still be taking like blood thinners and things like that. Yes, that kind of complicates things a little bit, Judy. I would hope that you are under a respiratory specialist, or have been in the past, and even if your GP is managing you well now, that's absolutely fantastic. Go GPs. And but if you need a bit more help, then maybe ask for a referral back to a respiratory specialist. So I think we've kind of come to the end of a lot of the questions that are coming through. And I will have to go shortly in order to get onto the phones this afternoon. Oh, Kylie, can asthma make you tired, etc.? My daughter's second last admission, she had asthma and pneumonia. Oh, yeah. And wouldn't wake up for me. It was scary. Oh, love. I think I'm a little stressed. Well, yeah, because I know winter is when she gets... I'm just pressing the see more. Because I know winter is when she gets worried. We have to keep going in and out of isolation during COVID, and she has autism, so it's hard to be in isolation with her. Yeah, okay, all right. Yeah, you can get tired with asthma. I mean, just think about it. Just think of all that work of breathing. and pneumonia as well. Like, so she, you know, didn't just have asthma, we've got pneumonia as well, which is an infection on top of that. So that really, really makes you very fatigued. But if you're, you know, breathing a lot, that's really, really exhausting. You know, so our normal breathing rate is sort of 16 to 18 per minute. So breaths, 16 to 18. When you've got asthma or any other lung condition and you start breathing fast, you can go up to 24, you can go up to into the 30s, you can go higher than that. And that's, you know, like running a marathon, really. So it is really exhausting. The body's fighting so hard to be able to breathe properly. It's fighting off the infection. You're going to get seriously fatigued. So yes, fatigue is an issue. And yes, I can imagine that you're that stress is going to be an issue for you with and trying to keep her in as well. Have you got onto the autism websites as well, Kylie, and the autism helplines, just with regards to how best to manage any behaviours that she's got in that area? And then, of course, you can always give us a call on our 1-800 number for some asthma support as well. So that was 1-800-278-462. Sorry, that was a bit fast. 1-800-278-462. I apologise. Lindsay, yes, good. I'm glad. Respiratory specialist. Yep. And have a spirometry test. Is that worth doing? Yes, spirometry is actually really important before seeing the respiratory specialist, because they are looking at what's happening in your lungs, how much air you can get out in 1 second, how much air you can get out over a period of time, how much air you can get back in, and comparing that to standard rates for your height, your weight, your age. And look, and that's kind of, you know, relative, because there'll always be people that are outside those kind of areas, but it's really important because we don't know what's happening in the lungs unless we can do spirometry. However, with COVID at the moment, they're not doing a lot of spirometry, so they might not do spirometry before the respiratory specialist appointment. It'll be dependent on the specialist as to whether or not they do it. So they're only doing it in a couple of cases here or there, urgent cases in the hospital, and a lot of GPs aren't doing them at all at the moment. And that's because you're blowing hard and fast through, it's got a filter on it, but you're still blowing hard and fast through a pipe that's attached to the computer to show the graph. So it's, you know, really, it's a huge big breath in, and then I'm going to blow hard and fast. I've got to keep going for 6 seconds, and you've got to do that repeatedly a couple of times to show repetition that the graphs are the same. So with a nose peg as well. And they'll say, keep going, 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 keep going for 6 seconds till you've got nothing left. So it's a maximal test. You can only do them from age 6 and up. That also helps with diagnosing of asthma as well. But as I said, at the moment, because of COVID, there's not a great deal of spirometry going on. If you do need spirometry, or you're worried that you're missing out, or give us a call on 1-800 number, 1-800-278-462, and discuss with your doctor as to when it will be available again. But in the height of COVID at the moment, they won't be. Someone liked my wheeze demo earlier. Did you like my wheeze while I was doing a spirometry as well? All right, so we've talked about viral triggers. We've talked about why viruses make the airways more sensitive and why prevent is really important. And coming into winter, that's very important, not even with regards to COVID, just even winter wellness is really important. So making sure that we're on a preventer if we can be on a preventer. Some of you have said that you can't, and if that's something discussed with your doctor or a respiratory specialist, that's fine. Hi Louise, how are you? And if you can't be on one, that's all right, and that's been discussed, and there's other management being put into place in order how to manage your asthma, then fine. But most people, even mild asthmatics, should be on a preventer. That is the standard now. So in kids, a little bit different. So ages 1 to 5, 6 to 11, that's a little bit different. It's based on symptoms and severity. and frequency of symptoms, if they've been to ICU, if they've had prednisolone doses like Redi-Pred mix. But in adults, even if you've got mild asthma, really should be on a preventer, because we're not treating the sensitivity in the inside of that airway, and we're not treating the asthma, the cause, you know, the inflammation cause of asthma, if we're not on a preventer. So if we're on a preventer, then hopefully then any virus won't trigger us off as much. That doesn't mean that you won't get a flare-up with a virus, because, you know, viruses are going to cause that irritation and sensitivity as well, on top of the sensitivity that you potentially already have there, and then that leads to an asthma flare-up. So trying to reduce the viral loads at the moment as much as possible. So keep up with the social distancing, keeping up with the really good hand hygiene and good house hygiene as well. So if someone's sick, wiping down benches, wipe down, you know, anything that they're touching, put stuff into the dishwasher as soon as they've used it. You know, 1 cup to 1 person. So if that person's sick, that's their cup, that's their knife, their fork, their spoon, all of that kind of jazz. You know, try and summon your inner nurse. Just think everything is icky, and you know, if you touch any of their stuff, then you're going to wash their hands. Okay, so just channel your internal infection control nurse. And everyone's getting really good at that, so good work. So social distancing, keep up with what the government's telling us to do there. Stay away from people that are sick. Get the flu vaccine. Okay, so making sure that we get the flu vaccine. Now, some people are saying to us that they're having difficulties trying to get it at the chemist or at their doctors. Some people are having access. So it really seems to be dependent on whether the chemist can just get stock at that particular moment in time. Same with the doctors as well. So just keep asking for it, please, and make sure you get your flu vaccine this year. Even if you've never had flu vaccine before, talk about it with your doctor, because we want to decrease any viruses you could potentially get, so that we're not getting an asthma flare-up from something that we could actually prevent. And we've talked about the Pneumovax, so that's the one for pneumonia on the feed already. So have a look at the vaccine information about the Pneumovax and who it's free for and who it's not. And same with the flu vaccine, so there is rules around who can get it for free and who needs to pay. And your GP will also, and your pharmacist will be able to help you out with that. Someone's asked me about have I covered off the nebulizers. I've talked about the nebulizers, about really not using them in the community unless they are part of their written asthma action plan and it's been deemed okay by their doctor, that they really need to be doing it, yes, in a separate room, open the windows, all that kind of jazz, try and keep you know, the misting away from other people in the house, and in the hospital that they're not doing it unless there's a really severe, you know, like if you need it, you know, like if they needed to nebulize antibiotics for a reason, or adrenaline or something like that, then, you know, they're gonna do that. You know, if it's a post-surgical type appointment, being in surgery, and, you know, they're still going to use nebulizers, because you can't hold a puffer and spacer. If it's part of bronchiectasis care, for instance, we've had some people that have crossover of asthma or bronchiectasis, nebulizers are still really important, a part of their care, then you know, they're still doing that as well, and just making sure that the health professionals are aware of that is part of your normal care. Let me just scroll down, because lots of things are coming through again. Should I get the pneumonia needle? Had flu shot 2 weeks ago. Judy, it depends on your age. Over 65 for non-Aboriginal and Torres Strait Islanders. So have a chat to your doctor about the pneumonia needle. Cassandra. Thanks, Cassandra. That's good information. Yeah, and with regards to the nebulizers, Louise, on the National Asthma Council, there's information there for patients and for health professionals with regards to, you know, using them. And also peak flow is another thing. We talked about spirometry not being done at the moment, but peak flows also is another thing, because we're blowing hard and misting stuff. So their areas, so spirometry, nebulizers, and peak flow monitoring might be something that's not done at the moment. Yeah. Have we got any other questions? Because I will have to, I have no idea what time it is. Can someone tell me what time it is? Please. Since I don't have a watch on, I've just got to make sure I get into the phones this afternoon. So if there's any other questions, if you do have some questions that you think of, you can always give us a private message. It does sometimes take us a little bit of time to get back to them, because it's generally the asthma educators that are answering a lot of those questions. So we have to read them, have a bit of a think about it, how we're going to phrase it. And it really depends on the amount of information that you're sharing as well. So I've said this on my last post, and I know people, oh, thank you very much, Lauren, 12:55. I will have to make a move very soon. Thanks, Kylie, as well. Oh, everyone's telling me, thanks. Oh, it's lunchtime. Apparently. Thank you so much, everybody. When you are sharing things on Facebook with us on Asthma Australia website or Instagram, etc., if you are doing a email inquiry to us as well, if there are specific health details that you want us to go into with you about your particular medications, etc., it is best that we don't do that in a public forum, and it is best that we don't do that over the email, because when we're emailing things, we can't be sure that when it leaves our servers and hits, your inbox, that someone hasn't seen that in that transfer. So we want to make sure your health information is kept confidential, and that we respect your privacy. So if there's something specific that you want us to answer with regards to your asthma situation, and it's not quite a very generic kind of question, then it is best if you could actually just give us a call on the 1-800 number. So that, once again, is 1-800-278-462. That's 1-800-278-462. Now, we have 2 people on helplines morning and evenings. We run from 9 till 5 in Australian Eastern Standard Time, and that's for Asthma Australia. So that is Queensland, New South Wales, ACT, Victoria, Tasmania, and South Australia. We endeavour to pick up every single call. Okay, that's really important to us, that we connect with all of you. If the first person is on the line, it will bounce to the second person. If the second person is on the line, it will then go to a voicemail. Can you please leave a message? Please, I beg you, leave a message. Don't be one of the people that just hangs up and doesn't leave a message, because then we can't get back to you, because we don't know what we don't know what you're engaging about. So could you please leave us a message, because we get back to all voicemails. Every single voicemail we will return. Okay, so please give us a call. Also, what's really important, as my friendly colleague here has put up, is the Asthma Assist program, which is also very important. It is on our website. If our website's working now, I can't tell because I'm not on my computer. Asthma Assist, we have a e-control pack that goes out to you. So in the e-control pack, there is basic asthma facts, information about medication and devices, what to tell your doctor, a whole bunch of brochures are given to you on an electronic format. Then there's also an email that goes out to you every 2 months. So we don't spam you, it's just once every 2 months. And any information about asthma, any changes, any research that's happening at that particular moment in time. So it's a really good touch point with us, that you can kind of keep on your asthma journey with us, and we can let you know if there's any changes in the air, what's happened with with the advocacy around the bushfires, anything changing in the COVID situation, things like that. We also have similar things for health professionals as well. So jump on our website if there's any health professionals out there that would like to connect with us as well. So apparently our website should be back up again soon. So if it's not available today, then jump on tomorrow. If you can't get the information that you want today, and you want it today, then give us a call on the helpline, and we will help you. And we'll try and give you as much information as we possibly can, and then send you some links to our website so that when it's up and running that you've got the direct link and you don't have to try and find things. Yeah, so I think that kind of wraps up our session today. Thank you everyone for listening in. Really enjoy these sessions, and I enjoy being able to answer everybody's questions as they come in. If I haven't answered something that you would prefer to mention over the phone, and it's private, then as I said, give us a call. But otherwise, I think I'll sign off there. This video should be uploaded so that you can watch back later if you've missed bits, or if you want to go over any of the information that I've given and you can't remember exactly what I said. But always give me a call if you need to. All right, so stay safe and stay well, and improve asthma control if it can be improved, and try and maintain asthma control if that's where you are and you're at that maintenance area. So good luck everybody. Thanks everybody. Thanks Kylie. Thanks Louise. Thanks Amanda. And I'll see you next time. Okay, bye-bye.